meet you. I'm Nurse Mad. I'm going to do your examination today before the doctor comes in. Okay, we need to fill up this form. Can you please verify your first and last name? And your date of birth? June 2nd, 89. Full code. Do you suffer from any allergies? Penicillin? Tape? And you're allergic to seafood as well. Okay. Primary language is English, correct? Okay. And who is your primary care physician? Dr. Serrano? Okay. Perfect. And I'm going to ask you just a few questions to see if you've ever had any of these chronic illnesses. Arthritis? No. Have you ever had any falls in the last 2 years? No. Okay. DVTs or blood clots? Okay. Any history of anemia? Heart palpitations? Okay. High cholesterol? How would you describe your diet? Okay. And any history of insomnia? Okay. Any history of respiratory failure? No. Any respiratory problems? Any tingling sensations in your arms, hands, fingers? Okay. And have you noticed any blurry vision, double vision? Okay. Have you ever had a tonsillectomy? Okay. Hysterectomy? No. Okay. Let's see. History of diabetes? Heart disease? No. Hypertension? No. Kidney disease? No. Okay. And any seizures? No. Perfect. All right. I'm going to go ahead and do a heart and a lung exam before the doctor comes in. Go ahead and relax for me, please. Just going to put this on your chest. Is it okay if I slide a stethoscope underneath your shirt? Okay, thank you. And take a deep breath in and breathe out. Very good. And again, take a deep breath in and breathe out. Okay. Looped up, looped up, looped up, looped up. Okay. Could not hear any murmurs, only S1 and S2. Okay. S1 and S2. No S3, no S4. Okay, I believe I have everything that I need from you. And now I'm going to step outside and let the doctor know you're ready. Just make sure that you are in a comfortable position to begin the cranial nerve examination, okay? Hi there, I'm Dr. Matt. I'm going to do your cranial nerve examination today. Alright, so let's go ahead and check your vision. Can you please look at my fingers right here? Alright, now look at my fingers right here. Can you please tell me which fingers are moving right or left? Good. 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 Okay, perfect. Now can you please tell me when you don't see my fingers in your field of vision? Good. 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 Perfect. Can you please follow my finger with your eyes only? Don't move your head. Okay, perfect. Now look at my finger right here. Okay. Let's go ahead and check your pupils. Okay. Good. Can you please follow my light? Okay. Okay, I'm going to ask you to look behind me, straight at the wall now. Good. Okay. Optic nerve is intact. I'm not seeing any scratches behind the retina. Right, and now same thing, look behind me, straight at the wall. And I'm not seeing any redness here. It doesn't seem to have any inflamed nerves. Okay, very good. Now let's go ahead and check your nose really quick. Can you look up for me, please? Good. Okay, very good. All right, let's go ahead and check your smell. All right, can you please take a deep breath in and breathe out? And what does that smell like? Cherries, very good. And one more. Can you please take a deep breath in through your nose and breathe out? What does that smell like? Dragon fruit. Okay, perfect. All right, let's go ahead and check your hearing. I'm going to make some noises in both ears, and I need you to tell me with which ear you hear the sound. Both. Okay, what about now? Left. What about now? Right. What about now? Both. Good. Okay. I'm going to whisper some words in your ears. Can you please repeat them back to me? A, B, C, D. Good. Cranial nerve exam. Good. Madpasmr. Okay, perfect. Madpasmr. Okay, very good. Alright, let's go ahead and check your facial sensation. So I have here a cotton swab, and I'm going to touch you on your face. I need you to tell me exactly where you feel this. Go ahead and close your eyes for me. Good. What about now? Good. And now? Okay, perfect. Did you feel that equally on both sides? Alright. Now go ahead and stick your tongue out for me. Good. And move it side to side, up and down, and touch, push inside your cheek with your tongue. Like that, and like that. On the other side. Good. Can you give me a big smile? Now frown. Puff your cheeks. Keep them puff for me. Don't let me unpuff them. Okay, good. Alright, let's go ahead and do a sharp or dull test. Now this is going to be relatively easy because I haven't noticed any abnormalities. I'm going to have you close your eyes, and can you please tell me if you feel sharp or dull? Dull. Sharp. Dull. Sharp. 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 Dull. Okay, that was very good. Alright. Okay, I'm going to put a drop on your tongue. Can you please stick your tongue out for me? Very good. And tell me what this tastes like. Cinnamon. Very good. And one more. What does this taste like? Vitamin C. Perfect. I will step outside now, and I'll have the other doctor come in and perform a scalp examination for you. Alright, and we do have about 5 physicians in this office who are going to come in and out and examine you. Alright, I'll see you back soon. Okay, well, I'm going to do your scalp examination now. Have you noticed any itchiness? Any dry patches behind your ears or anywhere else? No? Alright, well, I'm here to just do a checkup and make sure that everything looks good. And if I do see anything, I'm going to go ahead and do the treatment right away. Sounds good? Okay. Alright, so go ahead and relax for me, please. I'm just going to take a look here. Just trying to see all your doesn't look that bad. Well, I'm definitely noticing some dryness, which could definitely cause some itchiness, but nothing too major. Now, what we would like to do is to also increase your blood flow in your scalp, and that really helps a lot. Now, something about this side right here that I do not like how it looks. Okay, we could definitely apply some oils on that side, so let's go ahead and do that. Just gonna go ahead and scrub it in here. Scrub the oil. Make sure that it goes deep into the scalp, and we decrease any inflammation that is going on over there. Okay. I'm just gonna go ahead and just slowly tap. Okay, looks good. Okay, well, I'm gonna keep on going, okay? And okay, sorry for putting this here in front of your eyes. Just want to make sure that I am doing a very thorough search here. Okay, that's good. Okay, just gonna go ahead and palpate. Have you noticed any abnormalities with your shape? Okay, looks very good. Okay, looks very good. Well, I'm not seeing anything abnormal, so we still have 3 more doctors that need to see you. Hi. Okay, I'm gonna go ahead and examine your eyes. Have you noticed any blurry vision, double vision, any peripheral loss vision? Okay, so I'm gonna ask you to look right here, straight at my nose. Okay, keep on looking at my nose. Alright, now go ahead and look at my fingers right here. Yeah, now look at the light. Good. And now look at my fingers right here. And look at the light. Okay. Keep on looking at my fingers. Good. And now look at my fingers again. Okay, very good. Now I'm going to ask you to look right here. And now look right here. Alright. I did not see any rhythmic changes in your vision. Can you please follow the light with your eyes only? Don't move your head. Tell me when you don't see the light in your field of vision anymore. Now. 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 Okay. Alright, can you please tell me when you don't see my fingers in your field of vision? No. 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 Okay. Can you please go ahead and cover one eye? I'm going to do that for you. No worries. Can you tell me how many fingers I'm holding up? Good. 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 Can you please tell me when you see my fingers in your field of vision? Now. 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 Okay, good. Same thing on the other side. Alright. How many fingers am I holding up? How many fingers? And how many fingers? Good. Alright, can you please tell me when you see my fingers in your field of vision? Now. 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 Okay, wonderful. Alright, I'm going to ask you to look at my finger. Okay, keep on looking at my finger. I'm going to bring it very close to your nose. Good. Alright, let's do that one more time. Keep on looking at my finger. Okay. Alright, I'm going to press down on your eyelid. Can you please look up? Good. And same thing on this side, look up. Okay, very good. Alright, I'm going to examine your retina, make sure that there are no scratches behind and there's normal color. Very good. Can you please look behind me straight at the wall? Okay, good. And go ahead and keep on looking behind me. Good. Okay, keep on looking behind at the stethoscope. Okay. Alright. Now I'm going to ask you to look right here. Okay, look at the light. Follow the light with your eyes only. Don't move your head. Okay, and now look through the green circle. Okay. Look at the light. Keep on looking at the light. Okay, now I'm going to ask you to cover one eye. And can you please read the last row starting with the first letter to the left? L, D, F, B, H. And what color is this? Red. What color is this? Green. And what number do you see right here? 2. What number do you see here? 5. And which circle is bigger, 2 or 3? Good. Alright, let's go ahead and cover your other eye now. And can you tell me what color this is? Red. What color is this? Green. Can you tell me what letter this is? O. What about this one? E. What about here? J. Can you read the last row starting with the first letter to the left? H, B, F, D, L. Okay, very good. I'm going to step outside and I'm going to ask the next doctor to come in and do your examination. Alright, so go ahead and relax. Alright, my friend, I heard you're afraid of dentists. Is that correct? Alright, no reason to be afraid of me, okay? Okay, all you have to do is just open up your mouth wide, and I'm just going to do a routine dental checkup. There's nothing to be afraid of, alright? Everything is very safe. We sterilized all the instruments. I am not going to do anything without your approval. And first, I will explain everything that I'll be doing before I'll be doing it. Okay? Does that ease your mind a little bit? Okay. No worries. Alright, I have my magnifying glass here. I have my light. Now, can you please give me a big aha? Good job. Okay. So, what do we have here? Now, when did you take out your wisdom teeth from the right side? Okay, about a year ago. Good. And have you had any kind of issues after that? Any pains, any aches anywhere? No, that's good. Alright, and Can you tell me a little bit about how much you floss? Okay, I understand. And what kind of toothpaste do you use? Okay, that's good. Fluoride is good for your teeth, yes. Okay. I'm noticing your teeth are a little bit crooked in the front. Now, would you like to do anything about that? Okay. We can definitely do a treatment that will make them straight. Yeah. Okay. And now be honest with me, okay? Since we're very honest with each other, I would appreciate it. How many times per day do you brush your teeth? Oh, is that really? Okay. Okay, that makes sense. And do you like to drink coffee? You do, me too. Okay, well, I am seeing some stains here from, daily coffee routine that you may be having. Now, I do have some suggestions. You could brush your teeth every time after you finish drinking your cup of coffee. And that usually does help with any stains that the blackness of the coffee may put on your teeth. Okay, now I'm gonna go ahead and examine your upper teeth. Let's see. Over here. Oh, perfect. Okay. Alright, and let's see, what do we have there? Oh, it looks like there's a little bit of a cavity. Now, for how long have you had that before? That's very interesting. Okay, let's see. It looks about 4 to 6 months old. Yeah. And there's very little space in between your teeth here, and that's why. There was a lot of bacteria that gathered and had a feast on your teeth. And, everything that you leave in between your teeth is just very good food for the bacteria to multiply and create lots of cavities. Okay. Okay, now what I'm going to do is I would like to see if that cavity can fall off just by a simple scratch. Alright, so go ahead and open your mouth again wide. Now this is not going to hurt at all because I'm not going to go inside your tooth. This is just going to be superficial to see if the cavity is superficial. Okay, thank you. Open your mouth wide. Oh, almost. Okay, good. Okay, I am going to show it to you. Definitely. Oh, look at that. Alright, well, you might not be too excited to see this, but I am. So, I like that your teeth are clean again. Okay. Just gonna go ahead and set this aside. We're gonna let the technician sterilize them again. Alright. Well, I'll let you relax again, and I'll ask the next doctor to come in and do your examination. Alright. Bye. Hey, what seems to be the problem? Okay. Well, I can definitely take care of your ears and see if you have any wax built up, and if you do, maybe we can go ahead and get rid of it. Alright, well, what I'm going to do first is I will just make sure that you have full sensitivity on the outside of your ear, which is called tragus, is this cartilaginous part. Alright, so go ahead and close your eyes for me and tell me if you feel this, okay? Okay, very good. What about here? Okay, wonderful. Did you feel that equally on both sides? Okay, excellent. Alright, what I'm going to do now is I'll create some vibration sounds and I will put it behind your ear, and please tell me when you don't hear the sound anymore. Sounds good? Okay. Alright, so this is the sound. You can hear it. Good. Now go ahead and tell me when you don't hear it anymore. Now? Alright. Okay. Go ahead and tell me when you don't hear the sound anymore. Now? Excellent. Alright, what I'm going to do now is I'll put it in two positions. Position number 1 and position number 2. And I need you to tell me which position here is louder, 1 or 2. So this is position number 1. And this is position number 2. 2. Okay. What about now? So this is position number 1. And this is position number 2. Number 1. Good. Alright, let's go ahead and check your other ear. This is position number 1. And number 2. Number 2. Good. And this is position number 1. And this is number 2. Number 2. Okay. Alright, we're going to try the same thing now, and I need you to tell me if you hear a high pitch or a low pitch sound. Good. What about now? Okay. And what about now? Okay. What about now? Okay. Very good. Take a look inside your ears now. Let's see. Okay, perfect. Alright, so I'm going to have you look that way for me. Tympanic membrane is dark gray. I'm not noticing any extra fluids and just a normal amount of earwax. Alright, and now go ahead and look that way for me. Alright, there is definitely a little bit more earwax on your left ear, and I'm going to go ahead and schedule you for an ear cleaning, okay? Alright, thank you so much for coming in. I'm going to go ahead and ask my next doctor to come in. Hi, I'm Dr. Mad. I'm going to go ahead and do your face examination. So go ahead and close your eyes so that light doesn't bother you that much. And let's see, it's not that bright, right? Okay. And I'm just gonna go ahead and touch you right here. Okay. And elevate that. Just looking above your eyebrows. Okay, there's some redness. Have you changed your diet lately? This looks more like a diet problem, issue. And I'm not seeing any problems there. Maybe just some hormonal imbalance. It could be. Now, how many hours per night do you usually sleep? You do have dark circles, I can see that. It could also be a nutritional problem, so no worries. We can definitely look into that. I'm going to go ahead and just palpate your face. Let me know if you feel any kind of pain. Alright, can you please give me a big smile? And now frown. Puff your cheeks. Okay, perfect. Can you lift up your eyebrows? I'm going to try to push them. Don't let me do that. Good. Okay. And let's see. I'm just going to go ahead and palpate. Okay. Now I think we need to take some measurements to see if there is any inflammation. Okay, forehead. Good. Okay, now I'm going to do just a mental checkup here and do all the calculations in my head to see if there is any inflammation going on. Well, there is definitely some inflammatory process going on the left side. Now, I don't want to scare you. It doesn't look too concerning. I think it's just a nutritional deficit that you're suffering from. So I'm going to ask you to eat a little bit more onions and garlic. And that's usually going to help a lot. Now, I'm going to do a facial sensation test. So go ahead and close your eyes and tell me if it feels sharp or dull. Okay, dull and sharp. Good. And what about now? Good. And now? Excellent. What about here? Good. And what about here? And now? Dull. And what about now? And now? Dull. And here? Sharp. Okay. Okay, I'm going to take a few more measurements. So, looks like we have 2.2 here on this side. Okay, and let's go ahead and check on this side too. Okay, perfect. Let's see. Oh, look at that, exactly 2.2. So, no worries at all there. Alright, well, I am going to put everything that we did in the records today, and I'm the last doctor you were supposed to see. That's correct. Alright, well, I hope you had a very wonderful and relaxing checkup. It was a little bit more fast-paced, but that should not have done any harm. You were just able to get many exams today, which is really good. Alright, do you have any questions for me? No? Alright, well, in that case, I'm going to let you get dressed again, and we'll meet you up front.